Hello and welcome to the Neet PG discussion. These videos are tend to let you revise in the last 2 months, and these consist of most frequently asked topics which are very difficult to revise or very factual. So we'll discuss them in the format of MCQs which are asked, and then we'll also extrapolate what other MCQs could be asked. So let's start. So the first question is, the image shows ectopia lentis seen in which condition? So we are discussing about this image, the first image. Okay, so you see that the lens is first of all pushed superiorly. Okay, so the only condition where you have lens dislocation in the superior side is your Marfan syndrome, where you have superior temporal dislocation of lens. Whereas when you see this lens which is pushed inferiorly, you have the other condition where you have the dislocation of lens in the inferior and the nasal part, that is homocystinuria. And Weil-Marchesani syndrome has lens dislocation into the inferior anterior and forward. Alpo does not have ectopia lentis. Okay, so the first question was an ectopia lentis, and you can also expect a image based question. Second question is, which of the following renal tubular acidosis have hyperkalemia? So only type 4 has hyperkalemia. Okay, rest all the type of renal RTAs have hypokalemia. Okay, next, identify the test for diagnosing ACL tear. So we have different tests to diagnose ACL tear. So let's discuss the options. Okay, in the image you see the examiner is trying to test the laxity or the instability of the knee joint, and you see that the knee joint is at a flexion of around 15 to 30 degrees. Okay, so this test, what you see is Lachman's test. The other point is Lachman test uses very small amount of flexion of the knee joint, so there is less pain during the provocative test. So this can be used in patients who have acute injury, okay, in acute ACL tear, and hence it is most sensitive test. Whereas the most specific test is pivot shift test, and anterior driver test is the most commonly used test, where you flex the knee at 90 degree. Okay, but it is not used in conditions when acute injury, because there will be a lot of pain and exacerbation of the injury in anterior driver test. McMurray's test is a provocative test in meniscal injury, meniscal tear. Okay, next, if the image shows a capnograph the patient is suffering from. The capnograph, there are different type of capnograph and in different conditions. Here what you see in the capnograph is there is a sudden upstroke in the phase 3. This is phase 3, and there is sudden upstroke. This is seen in the cases of bronchospasm or obstruction of the partial obstruction due to secretions or foreign body, so or due to drugs. So bronchospasm will present as an upward stroke in the third phase, which is also known as shark fin pattern. Okay, rest in malignant hyperthermia you will have stepladder pattern, where you will have sudden ETCO2 rise, and curare clefts, you will see curare clefts as in, so this is there, and this will be the curare cleft. Such picture will be seen when the patient is recovering from the muscle relaxant. And in venous air embolism, for example, if in case you push a lot of air bubbles while after in the central venous catheter, so what will happen is, so if this is the your capnograph, you will see a sudden deceleration, sudden fall in the ETCO2 level. Okay, sudden fall in the ETCO2 level, which will be seen in venous air embolism. Okay, next question is, twin transfusion syndrome, there are Doppler changes. What is the stage according to Quintero staging? So in twin transfusion syndrome we have Quintero staging, so we will discuss Quintero staging here. Okay, so the three main important Quintero staging are 3, 4, 5. Okay, so in third you have Doppler changes. So Doppler changes as in what? You will have decreased or reverse and diastolic flow. Okay, the other point is, fourth is you will have in fourth you will have hydrops of one or both fetus, hydrops, and in fifth you will have fetal demise or IFD. Okay, next. Testicular tumor is a part of which men's syndrome. Okay, so testicular tumor is a part of men 4 syndrome. Okay, so in men 1 syndrome you will have parathyroid, pituitary and pancreas. Okay, in men 2A the major highlight is the medullary carcinoma of thyroid. In men 2B or type 3 you will have marfanoid habitus, which is more important. Okay, next question. Anti-LKM antibodies is seen in which of the following condition? This is a very hot topic in GIT medicine, and you'll have to somehow retain this table which is there. So in anti-LKM, LKM is liver kidney microsome 1 antibody. So anti-LKM 1 antibody is seen in chronic hepatitis C, and anti-LKM, so LKM 1, 2, 3. One is seen in chronic hepatitis C, and 2 is seen in drug-induced hepatitis, and 3 in chronic hepatitis D. Okay, and in also your anti-LKM 1 is also present in autoimmune hepatitis type 2. Okay, so you'll have to memorize these antibodies. Next question. Which of the following is a calcium channelopathy? So in all these 3 conditions, hyperkalemic periodic paralysis, Brugada syndrome and paramyotic myotonia congenita, these all are due to sodium channelopathies. Okay, and hypokalemic periodic paralysis is a calcium channelopathy, whereas in Anderson-Tawil syndrome you will have potassium channelopathy. So this is a very factual question. Next, which of the following are good prognostic factors for ALL? For acute lymphoid leukemia, you will have different prognostic factor, good and bad. So let's see. So hyperdiploidy is a good prognostic factor. Translocation 814, which is seen in Burkitt's lymphoma, is a bad prognostic factor. Translocation 1920, again seen in CML, is a bad prognostic factor. Translocation 1221 is a good prognostic factor. Females have a good prognosis, and age 2 to 10 has a good prognosis. So in the counterpart, hypodiploidy, bad prognosis. Okay, these both are bad prognosis. Males have a bad prognosis. Black race patients have a bad prognosis. Age less than 2, more than 10 years have a bad prognosis. So you'll have to memorize the table which includes the good and bad prognosis of prognostic factors of acute lymphoid leukemia. Next point. Among the following loop, which of the following is among the flow volume loops, which one of the following is seen in fixed upper airway obstruction? So you see a flow volume loop, and this is the normal loop. So we'll discuss each one of them. So you see in the second loop, what we see here is you will see so this is the expiratory part, this is the inspiratory part. Okay, you see that the flow volume loop is exactly the same but the smaller, so it is a miniature loop which is seen in restrictive lung diseases. In the third part, you see that in the expiratory part you have a indentation of the scoop. This is known as scooped out pattern or dog leg pattern. This is seen in obstructive condition. Okay, like emphysema. Here what you see in the fourth part is both in the inspiratory and the expiratory part you have a fixed amount of decrease. Okay, so this is a case of fixed upper airway obstruction. In the fifth part, you see the involvement is seen in the inspiratory part, and in the sixth part you see the involvement is seen in the expiratory part. So the fifth part is your variable extrathoracic obstruction, and sixth part is your intrathoracic obstruction, which will decrease the expiratory part, and your extrathoracic obstruction will decrease the inspiratory part. Okay, this was all about 10 different questions which included all the topics which are very frequently asked. So comment below your doubts and suggestions so that I can make more videos likewise. Thank you.